So, and the crazy part about the government system is it's related to your income. So, so if you come to Germany, and most of the expats have a very good salary, of course, because you don't choose to come to Germany for low salary, that would be ridiculous. But have a good salary in comparison for the average people here. And then you have basically to pay up to 20%, now it's even more, of your salary for the health insurance. The half is covered by your boss, and the other half you have to pay by yourself. Yes. Self-employed, when you are self-employed, you have to pay all by yourself. Yeah. So it's basically similar to the.
So what do like people pay for the health insurance? Let's make an example. You make 70k a year, right?
70k a year.
You have a good salary, right? Nothing crazy, but a very good salary. How much do you pay for health insurance?
For it depends on if you have children or not, but
so let's say single in the public health.
Okay, single in the public health insurance, you have to pay 10% of your salary. It's a bit more. It's 10%, 10 point everything, but 10% of your salary per month, of course, and up to, there's a cap up to, it's now it's 580 something per year. It changes every year. So basically you pay 480 euros at maximum per month.
So almost your part and the employer's part, almost 1,000 euros.
It's more than 1,000. Yes, because the employer has to pay something extra, but it's round about 1,000 euros, and it's rising every year, and it will rise in 2042. It did rise a significant amount in 2023. It was like 935, 940, something like this last year. Now it's over 1,000.
Wow.
And at average, the health system rises at 5.96% per year since 1972 this year.
5.9%?
Yes.
Oh, that's crazy.
You have some years that are crazy high percentage. Of course, it's the average amount, and then you have years where it didn't rise at all. But we started with, I think it was 80 euros per month.
Wow. Okay.
Of course, it was 1970. The people didn't have, people didn't.
It's a significant increase.
Of course, for many people hearing this, they think about, okay, that's crying on a high standard because everything will be paid. Yes, that's true. But on the other hand, you don't only pay your health insurance costs with 10 to 20% of your salary. You also pay taxes. So you can't compare, just say, okay, I have to pay so much for my health system and everything is free, and then there's nothing more. That would be great, but there is so much more you have to pay as an employee or as a citizen in Germany. Then there's the taxes, then there's the German pension system, and many more. So half of your money is gone, and then in comparison, what you get for it, it's not that great anymore. Yeah. It used to be very great. I think the idea of the system and the beginnings of the system was awesome.
So basically, to sum this up, when you have a good income, when you're a high earner, when you contribute much, you pay very, very, very much money in these systems, but you get very little in comparison out to what you pay, right? And that's, of course, a huge problem.
Yes, of course. In my opinion, it's good that if you have a high salary and you can pay more, then that you pay more. Yeah. I think it's a good system. Yeah. If you have only this in mind, but at the end it can't be. So
it's very social.
Yes.
I mean, the idea of contributing more. I mean, we are willing to contribute more to society, of course.
But at the end,
it has gotten to a ridiculous.
Yes. So it's basically 15 million pays for 85 or 83 million. I don't know how much we are at right now, but that's ridiculous. It can't work for a long time, of course. So but at the end, it's a better system than in most other countries. We can't deny that. So you come to Germany, then you have to be in the government or in the private system.